Doctors of Reddit, what's the stupidest patient you've ever had? Had a patient come in stating that he couldn't bend his knee. Asked him to remove his trousers so I could examine his leg. After he removed his trousers, the reason that he couldn't bend his knee was that he had a plaster cast around his knee. Checking his notes, he had been sent numerous letters asking him to come in for removal of this plaster cast, and as he hadn't attended any of the outpatient clinics, the hospital had assumed that he had removed the cast himself. I had a mom and grandma bring their 12-year-old daughter/granddaughter to the emergency room because she was bleeding. Not from trauma or a wound, mind you. The poor girl had started menstruating, and the mom didn't want to explain what was happening or started to happen, nor that it would continue to happen, as mom and grandma well knew. On the upside, it was a very quick visit once they were actually SE. I had to explain to a 17-year-old girl and her mother that she was not in fact allergic to alcohol, but she was just hungover. She complained that on nights when she drank too much vodka, usually on an empty stomach, that she would feel nauseous, flushed and sometimes vomit in the morning. But it didn't happen all the time, and there were no other typical symptoms of an allergic reaction. Irate mom who wanted to speak to the doctor because we took an unauthorized urine pregnancy test on 16-year-old daughter just before x-rays. I never consented, and now she's traumatized. Explained that it is standard in females of childbearing age and that consent to treatment was signed upon entrance to facility. Not good enough. They were at Southeast Asian, and I suspected that this routine standard was perceived as an insult to their status. I once had a child who swallowed a sizable magnet that passed to the intestine, and we were just waiting for it to pass in stool. The next day, when he came for follow-up, we just found out that he swallowed another one that got stuck to the first magnet in the intestine through the stomach wall, resulting in intestinal obstruction, and he was transferred to OR immediately to have them surgically removed. I worked at a pain management clinic in an attempt to combat opioid use/addiction/abuse. A lot of patients were prescribed a medicated cream. It looked a lot like sunscreen, and you just rubbed it onto the hurting areas. I watched the nurse carefully and slowly explain how to rub it onto the skin, using small, uncomplicated words and going through the motions of applying it several times. But every so often, patients would complain that their cream tastes bad. Paramedic. Got a call for a stroke. Patient had facial droop and slurred speech. Says that it feels just like the last time she had a stroke 10 years ago. Says that the symptoms came on about 4 days ago, and she knew the moment it was happening that it was a stroke, but didn't go to the hospital because she thought she could make it go away on her own. These stories make me chuckle. I'm also a paramedic and was called out for a stroke. Clearly the man was having a stroke. Upon doing a stroke screen, it looked like the patient had something large in his mouth. Thinking maybe this guy had some sort of oropharyngeal cancer or mass, I asked his wife if this was indeed the case, and she looked at me with a very puzzled look. She said no, and then I said, what is in his mouth? His wife then says it's a peanut butter and jelly sandwich that she shoved in there. When her husband's symptoms started, she thought it was just that his blood glucose was low, so she tried to force feed this poor man an entire sandwich before she called 911. Our job security. My dad is an orthopedic surgeon who does a lot of hips and knees and cries with laughter every time he tells the story of a woman who didn't understand how hip surgery works and thought they were going to take her leg off, fix the hip, and then reattach her leg. A guy came to the outpatient clinic with swollen left ball. He said he was injected with some cajupid oil by his friend with his consent to enhance his performance in bed. I'm a female medical intern, and I tried so hard to keep my expression as neutral as possible. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained alcohol, and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5. It just ate up the litmus paper. So shortly after he gets to the ICU, he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD, basically a procedure where they can look at the esophagus, stomach, and duodenum with a camera attached to a flexible tube, and the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He of course needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted for another issue. He was down to 90 pounds from about 150 and was getting fed through a peg tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. Paramedic here, called for a diabetic. I get there, and the patient is an older gentleman who is laying on a bed with what looks like a white mask on. I ask what's going on, and the family goes on to explain that he's a diabetic and the doc told them to give him frosting if his sugar gets low because the sugar content will perk him up. Turns out he didn't explain that they should put it in his mouth. That's right. They put a white frosting mask on this poor guy. Shocker, it didn't work. I have a few examples. Patient who recently been diagnosed with diabetes. We needed to adjust her blood sugar levels, but she kept eating sweets. So we had a talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation she went around drinking a soda. Another guy who had a benign arrhythmia of heartbeats irregularly. He knew that he could get the arrhythmia from time to time, but as long as he didn't faint or got any pain in the chest he could just take a beta blocker and let it pass. But he went to the ER like 6 to 7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran tests we found that he had a pH of 6.97. That is on the border of what the body can have and still have any function at all. He should be dead. But he was awake and clear. We wanted to admit him to the ICU and adjust it without most care, but he needed to go home to eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes. That no shrimp sandwich in the world is worth your life, and if there is something else you need to get help with we can help him. But nope. He left. He came back a couple of hours later and we cured his acidosis. But that must have been a mean shrimp sandwich. Not a doctor but dental nurse. My favorite was a 30-something-year-old woman who came in for a checkup at the emergency low-cost clinic I worked at. Teeth were broken and almost black and gums are angry swollen, bright red and bleeding by just moving her tongue against them. Needed multiple scaling/hygienist appointments and a debridement. Honestly, YouTube has some amazingly disgusting videos of this treatment, but maybe keep the sound off if you don't like the scraping sound. X-ray showed she had all but her wisdom teeth and 10 fillings, root canals to try, and save some teeth and extractions for I think 3, but more if the RCT didn't work. Explained everything and did the usual explanation of proper oral hygiene. Asked her if she had any questions, to which she says, "It's okay if I lose this set of teeth, my others will come through." Me and the dentist just looked at each other probably a lot longer than we should have. No words. I couldn't think of anything to reply to that comment. I had a lot of weird and disgusting things happen at that clinic. I actually miss working there. My wife is an RN who works at an outpatient surgery center. Cataract surgery is one of the common surgeries that they do. Patients are told that after the surgery, they should put eye drops in 4 times a day for 1 week, so 28 drops altogether. One patient asked if it would be okay to just put the 28 drops in all at once, so they didn't have to deal with it for a week. Maybe the guy who had previously had an anaphylactic reaction to a foodstuff, but wasn't sure he was "really allergic," so thought he'd test it out by bringing some to the ed waiting room and eating it. Spoiler, he was really allergic. Respiratory therapist here. Was working and was told we were getting a patient in respiratory distress. When she gets in, she is having problems breathing and need oxygen, placing an oxygen mask on her, and she yells, "I'm allergic to oxygen." I heard the doctor laugh behind the curtains. My one patient used to hold in her farts to the point of being in antagonizing pain because she thought that there was a certain amount of air inside a person, and if you let too much out you'll deflate. Oh duck, if we're talking stupid ed visits. A woman came in because she got stung by a bee, not allergic and no reaction. It just hurt. A woman brought her kid in because he got stung by a bee, not allergic and no reaction. An entire family came in because they found a dead mouse in their apartment. Woman came in for a second-degree burn on her arm. That was roughly the size of a Tic Tac. A woman spent like 5 minutes explaining to me that because of all the vaccinations we give dogs, we're seeing a rise in doggy autism. I like to call it portism. Had a patient and his girlfriend complaining of fleas. They were covered in red spots that they were picking at constantly. They were meth heads that were picking their skin off and imagining bugs were crawling on them. They were adamant that they had seen these bugs and pulled them out of these sores. Discharge instructions: stop doing meth. We had a young methamphetamine addict present with upper abdominal pain. She had a gastroscopy and deteriorated afterwards. Court showed she had a perforated stomach following the procedure, the worst possible complication, and would need emergency surgery. Despite the damage, she was not clinically too unwell yet. Despite hours of counseling/pleading, she self-discharged later that day to go home and smoke meth. Never heard about her again. Not a doc, but work at an I was putting in charges one night, and one of the doctors had forgotten to mark the chart appropriately, so I looked at the diagnosis. It read imagined object in vagina. I went back to joke about this, and got the story. A woman came in, and said she'd accidentally sat on a cactus, and had spines in her vagina. The doctor, with a female nurse in the room, had to go looking, and never found a single thing, including any wounds or signs of irritation. When I asked why someone would do that sarcastically, the doctor on at the time said, "Well, I guess if you've got nothing better to do on a Friday night." A 20-year-old girl came in with abdominal pains. We did a pregnancy test and she was pregnant. She acted surprised because she was on the pill. I asked her how long she's been on it and if she had been taking it daily as prescribed. As if it were the most logical thing on the planet, she said she did not take it daily because she did not have sex daily. I looked at her, trying hard not to laugh. She only took them right after she had sex with her boyfriend, so like maybe a couple of times a week. Had a guy come into the earth for hiccups yesterday. Lol edit. I just got a million messages as to why hiccups almost killed people or some guy they know. Holy crap. This was not the case. No acute symptoms, no abdominal or thoracic complaints, no pain, no sob or dyspnea, no abnormalities, normal radexums. He just came in because he was hiccuping. He was not dying. It wasn't a vagus nerve tumor or acute pancreatitis. It was hiccups. Just hiccups. Calm your tits, Jesus or Mayo. Not a doctor. Work with them. The episode I can't forget is the time a patient with established coronary artery disease and current chest symptoms was in having an imaging cardiac stress test, and he sent out for a large cheese-steak calzone to be delivered to him between the stress and rest portions of the exam. I'm not a doctor, a nurse, or a medical student, but 3 years ago my Mill was diagnosed with mouth cancer. Prior to that she was a 2 packs a day smoker. She, my Phil, and my husband are adamant that smoking had nothing to do with her getting mouth cancer. They were convinced it was only her genetics. Dental student. I have a patient that claimed to have gone to medical school. Here are some gems from this patient. Patient: hey doc, do I need to move my head medial or distal? Me: no. Move your head to the right. Patient: do you remember the Matt Hasselbalch equation from organic chemistry? This is the old QB of the Seattle Seahawks. Patient: after looking at the X-ray or a radio pack, has density mass in their mandible. Doc, this is malignant mass because I don't have the lymphadenopathy. Malignant means the bad cells can invade other areas. It's bad. The mass in the X-ray was a supernumerary tooth, or extra tooth. It is within the spectrum of normal. Patient: can you adjust my lingualized occlusion please? My mesiodistal cusps are fracturing. There is no such thing as lingualized occlusion. There are no mesiodistal cusps. Patient has severe bruxism. TLDR. Patient claims to have gone to medical school, but uses phrases that would indicate otherwise.